Hello. Hi, everyone. Good evening. Thank you so much for coming tonight, and welcome to Healthy Living, Healthy Skin. We're so excited to have you join us. My name is Sandy, and I'm the Assistant Director for Young Alumni Engagement. I'm also a Young Alumna of UCLA, graduate in 2010. I work for the Young Alumni and Student Engagement team, and our team is responsible for bringing you programming like this, events that grow with you. And what that means is they are events that you can learn something and take away something and also utilize it in the future. So tonight we're really excited to have Dr. Jenny Hu with us. She's actually a double Bruin, MPH and MD. She also did her residency here, and she currently works out of the office, the UCLA Health Office in Thousand Oaks. She's going to walk us through the best way to protect our skin, how to eat right for our skin, and also what skin products we should be using, what ingredients we should be looking for as we buy skin products, because there are tons of things on the shelves at Ralph's or CVS or in Macy's or Nordstrom, so we got to choose the right one. There will be a Q&A segment after the presentation, so hold your questions until then. And then hold on to that little ticket you got at check-in. We'll have a lot of giveaways for you, and no one will walk away empty-handed tonight. You promise. So without further ado, all yours.
Thank you. Good evening. Thanks for coming tonight, and I was very honored to be asked to speak at your event today. Again, my name is Jenny Hu. I'm an assistant clinical professor at UCLA in the Division of Dermatology. I specialize in skin cancer surgery called Mohs micrographic surgery and facial reconstruction as well. So I'm very happy to have you guys here today. Knock it? Okay. Oh, sorry. Thank you. Sorry. Okay. So this is my daughter, Audrey, and my son, Bradley, and in June they'll be 5 and 2. And they look very sweet. But if any of you guys have kids, or have nephews or nieces, or have friends who have kids, you'll realize that they are very blunt, very honest. They have no filter in their mouth. So anyways, one day my daughter is really intently staring at me in the face with this inquisitive look. And she says, "Mommy, what are those cracks in your face? It looks like your eyeballs are going to fall out." So I literally just dropped down laughing. It was so funny. So, but I go ahead and try to explain to her, as we do to our kids, we try to explain things. So I say, "Well, Mommy's skin is not like your skin because Mommy is a grown-up." So she says, "Oh, you mean you're old?" And I guess I can't expect a 3-year-old at that time to really understand the concept between old and older. So, it's fine. But anyway, she loves to draw. And several months later, she loves drawing me pictures. And several months later, she draws me this picture. And she says, "Mommy, these are the cracks in your face." So it's like, "Thanks, Audrey." I guess I should be very proud that my daughter's detail-oriented, I guess. But she got the number of fingers wrong, but it's okay. So anyways, the timing of this talk is actually perfect because next month, May, is Skin Cancer Awareness Month in terms of melanoma as well as non-melanoma skin cancer. So hopefully you do take away a lot of information from today. I also, a lot of my patients, they always tell me, "Well, I wish I would have known how to protect my skin when I was younger. I wish I would have known." It's kind of too late because they're developing a lot of these skin cancers. It's never too late, but it's really great to have this information when you're young and to think about it now. So just some fun facts. How many people were diagnosed with skin cancer in the US in 2009? Is it over 10,000, over 100,000, over 500,000, or over 1 million? So show of hands, or yeah, go ahead. You can yell it out. You guys are so smart. So D, over 1 million people. So there are actually, in 2009, 3.5 million cases of skin cancer diagnosed in this group of 1 million people. And so skin cancer actually is diagnosed there's more people diagnosed with skin cancer than breast, lung, colon, and prostate cancer combined. About 1 in 50 Americans will develop, 1 in 5 Americans will develop skin cancer at some point in their life. And it's becoming more of a problem, I notice, in the young generation, the young population, because I do have a good number of patients in their late 20s and early 30s already developing fairly large-sized skin cancers of the face, in which I have to do surgery for. So, I mean, you guys are really at that population where you should really be thinking about protecting your skin. What is the rate of death from melanoma in the US? Is it 1 person every week, 1 person every day, 2 people every day, or 1 person every hour? D, you're right. So it's a lot. So people are dying of melanoma every hour. So it's really a scary thought to think about that. So there's a cause of concern because in the past 3 decades, more people have had skin cancer than all other skin cancers combined. Again, as mentioned before, 1 in 5 Americans will develop skin cancer at some point in their life. And actually 1 in 50 Americans will develop melanoma at some point in their life. Melanoma is known as a deadly skin cancer because it can spread to your other organs and be fatal. This is a very concerning number because about 10 or 20 years ago, it used to be only 1 in 70 people who were developing melanoma. So the incidence of melanoma is on the rise, despite us having more knowledge of skin cancer and melanoma. Melanoma is also the most common form of cancer in the young adult population, age 25 to 29, so it really fits this demographic as well. And if you've had more than 5 sunburns in your lifetime, then your risk of developing melanoma doubles. So that's very scary. Has anyone here used a tanning bed or have a friend who's used a tanning bed before? Raise your hands. I've known people who've used it. So there's been a lot of recent evidence showing and studies showing that tanning bed use is really associated with increased risk of skin cancer, including melanoma as well as non-melanoma skin cancer. And so this has been a really hot topic of research in the past year or 2. So in terms of your risk of melanoma, it increases by 75% with only 1 tanning bed use. And your risk of squamous cell carcinoma, also known as, or SCC for short, which is the 2nd most common form of skin cancer, increases by 2.5 times. And your risk of developing basal cell cancer, or BCC, is increased by 1.5 times with tanning bed use. So I just wanted to go over a few pictures of, to help you identify basal cell cancer, squamous cell cancer, and melanoma just really quickly because, like I mentioned before, I am seeing this in much younger patients now. Like I said, I do have a good number of patients who are in their late 20s or early 30s developing these pretty large ones because they were unaware that they're really at risk for skin cancer. So with basal cell carcinoma, this is the most common type of skin cancer that you'll find. And oftentimes they present as kind of small little pink or shiny papules, or papules is like a bump. So as you can see here, it's a little pink kind of shiny bump. This one is just barely visible. Here shows that in the middle, it's kind of getting scabby and not healing. And this is one type of basal cell too, where it's like instead of being more of a bump, it gets kind of indented in. So there's a subtype of basal cell carcinoma called infiltrated, where it actually kind of pulls the skin in. And so this is a little bit more aggressive form of basal cell cancer, where it goes much deeper than the usual one. So squamous cell carcinoma, this is the 2nd most common type of skin cancer. They look a little bit different from the basal cell cancer in that they're a little bit more red and crusty or scaly, as you can see here. Not as much of a shiny bump. In this one, it's what we call a very thin type of squamous cell cancer, where it almost looks like a very flat, patchy area of rough skin. This is not to be confused with, of course, people will be getting eczema or what we call ringworm, which is like a form of fungus infection of the skin. But oftentimes, if this is persistent and it's not going away with any treatment, when you're treating it or you go to the doctor and treat it, then you need to be concerned that this may be an early form of skin cancer. And then I don't know if any of you have heard about the ABCDEs of melanoma. Okay, so about 5 years ago, they added E to this mnemonic, and so anytime, these are kind of the things you want to look for that may be more concerning for melanoma. So if you have any one of these signs, it doesn't necessarily mean that you do have melanoma, but especially if you have multiple signs of these, then it's a little bit more concerning of melanoma. So A stands for asymmetry. So if you have a mole that's not symmetric. B stands for border. So if your border is not smooth, but instead it's kind of jagged or ragged. C stands for color. So if you have kind of different colors in your mole. D stands for diameter. So if it's greater than 6 millimeters, which is the size of a pencil head eraser, it's a little bit more concerning for melanoma. And then E stands for evolution, which is a new one they added. So anything that's changing in your mole, whether it be growing or getting bigger, or if it's bleeding, those are kind of signs that are concerning that it may be a melanoma you might be developing. So, and again, melanoma is the most common form of cancer in young adults aged 25 to 29, so it's going to be very important to be looking out for this. And if you're not quite sure how to be looking out for it, you can also make an appointment with your local dermatologist as well. So I just wanted to briefly go over UV radiation. So UV radiation is what we're concerned about damaging our skin and causing skin cancer. So there's actually 3 forms of UV light. There's UVA, UVB, and UVC. So most of UVC is actually filtered by the ozone layer through our atmosphere. So most of the UVC actually does not reach the Earth's surface. So most of the UV radiation that reaches the Earth's surface is in the form of UVA and UVB. And UVA penetrates a little bit deeper into the skin as opposed to UVB. And UVB is a little bit more responsible for sunburning, whereas UVA is a little bit more responsible for skin aging, including wrinkling. But both of these can contribute to skin cancer. So I wanted to talk about the SPF, or sun protection factor. So a lot of people don't realize that SPF only determines how much protection it has for UVB rays. So it doesn't indicate at all how much protection it has for UVA rays. So in the past, we were always concerned about UVB rays because those are the ones that we thought were most contributable to skin cancer, but now we know that UVA is also responsible as well. So about 2 years ago, in December of 2012, the U.S. Food and Drug Administration, or the FDA, had wanted to develop a standardized test of testing over-the-counter sunscreens to determine which ones are broad spectrum. Broad spectrum meaning that they cover for both UVB and UVA, because again, UVA does cause cancer as well. So for a sunscreen to be labeled as broad spectrum, if it's labeled as broad spectrum and SPF 15 or higher, then you know that it will protect against both sunburn as well as reduce the risk of skin cancer and aging. So if a sunscreen does not protect against UVA, they're not allowed to label their product as broad spectrum. And if their SPF is less than 15, then it's only going to protect you against sunburn, but it won't protect you against skin cancer. So again, anytime when you're looking at over-the-counter sunscreens to purchase, there's 2 things you really want to look for. One is that it says broad spectrum, because this is a new regulation labeling by the U.S. Food and Drug Administration. So you want to make sure it says broad spectrum, or it says UVA and UVB protection. And the second thing is you want to make sure it's at least an SPF 15 or higher. Nowadays, as dermatologists, we actually recommend an SPF 30 or higher, and I'll tell you why in just a second. So SPF, then everyone always asks me, what does this number really mean? So this number means it's a theoretical amount of time you can stay in the sun without getting sunburned. So for example, if you're using an SPF 15 sunscreen, and so this basically allows you to stay in the sun 15 times longer than you would without protection before getting sunburn. So let's say you're in the sun and you normally, without any sunscreen, you get a sunburn in about 10 minutes. So using an SPF 15 sunscreen, you want to multiply 15 times 10, so that theoretically allows you to stay in the sun for 150 minutes before getting sunburned. But in reality, this doesn't really happen because there's a lot of other factors that are dependent upon your sunburn. So meaning, for example, did you put enough sunscreen on in the first place? Did you sweat, or did you get in the water and not reapply? Did you apply it evenly, or did you apply it frequently enough? So we do recommend that when you're out in the sun that you reapply your sunscreen every 2 hours. And another question I get asked a lot is, I heard that SPF 50, anything higher than that, it's not really important to go much higher than SPF 50. So how much UV protection do we get by the different SPFs? So if you can look at this diagram, this is basically the sun. So if you don't have any sunscreen on, then all of the light, the UV light, goes into your skin. For SPF 15, you get about 93% protection from the UV rays. And at SPF 30, you get about 97% protection from the UV rays, which is why nowadays, a long time ago, as dermatologists, we used to recommend at least a SPF 15 or higher, but we actually prefer you use a SPF 30 or higher because it protects against at least 97% of the UV rays. And when you get to SPF 50, it protects against 99% of the UV rays. So we definitely recommend a SPF 30 or higher. And as you can see, this is just a graph to depict what I was talking about. So this is the SPF of the sunscreen, and this is what percent it's protecting you from. So at SPF 15, it protects about 93%. SPF 30 protects about 97%, and it kind of just plateaus right here. So right about SPF 50, you protect against 99%. So again, anything with SPF 30 or higher is good. But you have to remember that you have to reapply every 2 hours. That's the main thing that people always forget. So what's the difference between the physical sunscreens and chemical sunscreens? So as you can see here, physical sunscreens with a happy face, it acts by reflecting the UV rays away from it. So it's actually a physical blocker. When you look at chemical sunscreens here, what it does is it converts that light, it absorbs it and converts it to heat, and it gets released. And that's how it chemically blocks the UV rays. So both of them are really good, so long as you select chemical sunscreens that are more broad spectrum, which I'll show you which ones are. But the physical sunscreens, which include zinc oxide and titanium dioxide, those are the two physical sunscreens, they are broad spectrum, which means they protect against both UVB and UVA. So again, physical sunscreens physically block the UV and UVA off the skin, and so the ingredients that are physical sunscreens are zinc oxide and titanium dioxide. These are the ones that when we're younger, they were really white and pasty. You see them on the lifeguards and swimmers, and it's like a stripe down their nose. But they micronize it now, which means they make it in smaller particles so that you can be using these physical blockers, and it's pretty clear on your face. So it's more kind of cosmetically pleasant for people to be wearing instead of having like a white face, So, and then chemical sunscreens, again, they absorb the UV light and they convert it to heat, and that's how it blocks it. So these are the ones you really want to look. These are the main ones you want to look for that are broad spectrum. Again, that blocks both UVB and UVA. So avobenzone, Mixoryl, which is a particular one in La Roche-Posay products, and Helioplex, which is in Neutrogena. So most sunscreens, I would say nowadays, really. Despite the Neutrogena, La Roche-Posay ones, if they have a chemical sunscreen, then most of them will have the avobenzone. They have other chemical blockers a lot of times mixed in there as well, which do not protect against both, but they just kind of mix in different sunblocks in there. So this picture, not about partying, but it's about to really remind you about how much sunscreen you should be applying to your body. And it does seem like a lot, but it's really important to be applying enough. So basically, for a shot glass, you need 1 ounce enough to fill a shot glass. So with this filling the shot glass amount of sunscreen, this is the amount you need to be applying to the exposed parts of your body. Of course, with people who are different like heights or anything like that, or then you may be applying a little bit less or more. But you really do need to be applying a lot. If you can't judge by this, then a lot of times what I tell people is at least put on 2 layers of sunscreen. Put 1 layer on and put a second layer on. Do at least that. Oh, just another couple comments. So a lot of places that people think about protecting, they forget about putting sunscreen on is their ears, especially men. And then also the scalp for men who may be losing a little bit of hair or balding. And for women in the part line, women tend to get skin cancer within the part line area there. So it's always very important to apply sunscreen there or wear a hat. And again, you want to use a SPF 30 or higher. You want to reapply every 2 hours. You want to make sure you put it on an even layer. And then wear other kind of protective clothing such as long pants, long shirts, a broad-rimmed hat. Sunglasses is really important as well because we are seeing a lot of skin cancer on the lower eyelid right here. So just make sure you kind of do that. And then for the next part, I'll be talking about skin aging and your diet. I do get asked a lot of questions about, what is it in my diet that I can eat to help with my skin, or what kind of products should I rely on that's in the cosmeceutical over-the-counter kind of products? Which ones should I really rely on, or do you think that may help? So I get a lot of these questions from younger people as well as older people, so just in case you were curious. Also, about 90% of our signs of skin aging, such as wrinkles and sunspots, are really attributed to the UV radiation. For people who wear sunscreen daily, they show about 25% less of skin aging as compared to people who don't wear sunscreen daily. And actually only about 25% of our lifetime exposure to the sun occurs before the age of 18. So after 18, you're still going to be exposed to about 75% of your lifetime of sun exposure. So it's really important that if you're not protecting yourself from the sun now, that you start, it's a good idea for you to start protecting from it now. So I just kind of wanted to briefly go over the two different categories of aging. So there's something called extrinsic aging and intrinsic aging. So intrinsic aging is basically also known as chronologic aging, but this is really due to kind of your genetic background mainly. And extrinsic aging means anything that's kind of due to outside of your body. So the main source of extrinsic aging comes from UV radiation. But other things are also affect your extrinsic aging, which also includes toxins such as tobacco. So if anyone smokes, also includes any other type of X-ray radiation and any other kind of pollutants and things like that as well. So these are the main vitamins that are really have some sort of important function in the skin. Mainly a lot of this has to do with collagen building and keeping up the elasticity of the skin. So this is just a brief overview, and I'll go through each one individually. But vitamin A, so they're divided into two subcategories. One is carotenoids and one is retinoids. So the carotenoids may prevent UV-induced collagen breakdown, and retinoids, which I'll go over more specifically, does increase collagen, increases the thickness of the epidermis, which is the first layer of the skin. And because it does increase the thickness of this first layer of skin, it decreases the appearance of fine lines. And also some studies have shown that it may help you also protect you from skin cancer if you use it. There's vitamin C, which also increases collagen in your skin, and theoretically it may protect your skin from any UV-induced damage. There's vitamin E, which regulates the breakdown of collagen and also protects your skin from UV-induced damage. Vitamin B3, also known as niacin or niacinamide, again, increases collagen production and also decreases your skin pigmentation, so like any darkening of your skin or sunspots of your skin. Vitamin D protects against UV-induced skin wrinkling, and vitamin K really decreases the sun damage of your skin that makes you look more red. So a lot of times people who've had a lot of sun exposure have a little bit more redness to the skin, and so vitamin K helps with that. So this is just what these vitamins do normally. But then we'll talk about diet versus if you use anything topically for it. So vitamin A, again with the subgroup of the carotenoids, there hasn't been a lot of great research showing that carotenoids could really be protecting against UV-induced damage. There was some small studies that with a small number of people that show that if you do kind of use long-term supplementation of carotenoids, long-term in the about 4 to 6 months, that it did show some protection against UV damage. But there still has been very limited data on this. But it's not a bad idea to be eating healthy anyways. So these are basically a list of carotenoid-rich foods here. So this is from the National Institutes of Health, the Office of Dietary Supplements for Professionals. So I just basically listed the top foods that have at least 20% or more percentage daily value, which is this column here. Anything that has greater than 20% is considered that supplement-rich food. So in here, you can consider sweet potato, beef liver, if anyone likes to eat liver, spinach, carrots. I really like pumpkin pie, that's a great one. Cantaloupe, sweet red peppers, mangoes, black-eyed peas, dried apricots, actually, and also broccoli. So this is all healthy food we probably should be eating anyways. And then the other vitamin A, the other subcategory of vitamin A, which is a derivative of vitamin A, is a topical retinoid. So you guys may have heard about retin-A or retinoids, retinol. So this is in the subcategory of topical retinoids. So these have shown, with scientific evidence, it has shown that it actually increases collagen. It also increases the thickness of the first layer of the skin. So again, because of that, it reduces the appearance of fine lines and wrinkles. And again, it does have a preventive effect with skin cancer when used on your skin. So usually, basically the topical retinoids have had the most scientific evidence showing that this really does help with skin aging. So if anyone comes to ask me, what is it that I should be using on my skin to help make my skin look better, for fine lines and prevention. My first line is really to use a topical retinoid because there's just so much scientific evidence showing this. The different topical retinoids include tretinoin, and the brand names of tretinoin, tretinoin does come as a generic, so you don't have to get it in a brand name, but brand names you may be familiar with would be Retin-A, Renova, and Avita. And then there's tazarotene, so you may have heard of Tazorac, Avage, or Fabior. And then there's over-the-counter, which are non-prescription, because these two are prescription strength, and these are a list of over-the-counter ones. So the prescription strength ones have the most scientific data really showing that it helps with skin aging. There's a little bit less evidence for the over-the-counter ones. They're not as strong as a prescription one. So if you're not ready to use a prescription one, then you can always look for one of these ones over here. So these include retinol, retinaldehyde, retinol ester, and oxyretinoid. So from the studies that looked at these four over-the-counter retinoid ingredients, the retinol is the one that's shown the most data that it helps. So if you're going to get an over-the-counter one for skin aging, I would recommend getting retinol. If you want a prescription strength, which there's a lot more scientific evidence for it, then would go to your dermatologist and get the tretinoin or tazarotene. Sometimes people are afraid to use these because they can be irritating to the skin, but as long as you're kind of combining with a very gentle cleansing program and using a lot of moisturizers, and you kind of want to work up to being able to use it every day, then it becomes more tolerable. So, but it's definitely, this is something, they're used for acne, but this is definitely something good to start earlier, because I do notice that when used earlier on, you'll definitely see a lot more changes, a little more changes than if you start it like when you're 60 or 70, which I do have patients coming in and they ask me, and when they're 60, I do start them on it. But you'll definitely have more improvement, and you'll see the improvement really over 3 to 4 months and kind of peaks around 12 months. So you really have to use it for a long time to see some improvement. So you just have to be patient. Then there's a lot of if you read magazines and everything, I don't know if you guys see a lot of talk about vitamin C or ascorbic acid. So this vitamin C normally in the skin, it does increase the stability and production of collagen in the skin, and there has been scientific data showing that as well. And also acts as an important antioxidant in the skin. So there's been a lot of clinical trials looking at vitamin C, and the clinical trials have used their compounded formula of ascorbic acid, which is vitamin C, but they've used serums, creams, a 5% cream and a 10% cream. The problem about vitamin C as a topical is that it's really hard to produce it in a topical form, that it's stable in that form and it doesn't break down. So even though there's a lot of information and evidence showing that vitamin C could really help, it's just really difficult for these cosmeceutical products, which are the over-the-counter ones, to develop a formulation where the vitamin C is actually active. There's a lot of products out there where you can purchase it and it's not going to be as active. But the problem is that these cosmeceuticals are not regulated by the U.S. Food and Drug Administration. So there's no, they're not forced to present clinical trials and things like that to show the evidence that they actually are helpful. So there's a lot of different forms of vitamin C that you can find in these products. These top 3 here are the ones that you'll see in most of the commercial products out there. And these are the other ones that are also derivatives of vitamin C, but they're not as out there in the commercial products. So out of these 3, the ones that have shown more evidence of being a little bit more active is the ascorbyl glucoside, sometimes also shortened as AA2G. So this one has shown, out of these top 3, has shown that it has better penetration through the skin. Because one thing about formulating any creams is that you have to make sure that that ingredient can penetrate through the skin, into the skin, and do its job. And then the other problem is, does it break down? That top one is the one that's shown more evidence that it's a little bit more stable in the skin and it can cross the skin barrier. So again, with any vitamin C products, it breaks down when it's exposed to oxygen or light. So if you're going to be looking for a product with vitamin C in it, you want to be looking with an airtight container, so probably like a pump. You don't want to use a screw top, because once you unscrew it, all that oxygen is going to get into there and it's going to degrade and break down that vitamin C. If you see any discoloration or yellowing in the product, that's an indication that it's already breaking down, so it's not going to be working that much. If you want to talk about your diet, so these are some vitamin C rich foods. So it's a lot of citrus fruits, again, sweet red peppers, broccoli, strawberry, tomatoes. So this is a list of all the things that have anything greater than 20% daily value is considered a vitamin C rich food by the Food and Drug Administration or National Institutes of Health. So vitamin E in the skin, it does regulate collagen breakdown, and it has shown to decrease the amount of redness that you can develop after you get exposed to UV light. So there was a small study where when they applied vitamin E to the skin and then they went out and were exposed to UV light, that their amount of redness actually, it took longer for them to become red than it did without the vitamin E. But this was a small study. So, but there's no scientific data at this time to really support topical vitamin E for improving skin wrinkling, discoloration, or texture. And the other thing important to note is vitamin E, for vitamin E to work and be stable, vitamin C is important for that to be stable. So you want to make sure that the vitamin C is also incorporated into the vitamin E. And then vitamin E rich foods that you want to look for. So wheat germ oil, sunflower seeds, almonds, sunflower oil, safflower oil, and hazelnuts. So a lot of the nuts. So vitamin B3 or niacin or niacinamide, this increases collagen production and also reduces skin hyperpigmentation. Again, kind of similar to the previous vitamin, that there's not a lot of clinical trials with it right now, but more recently there has been a lot of more interest in it, and there's been more kind of promising results for niacin, niacinamide, but at this time there's not a lot of studies for it right now. And then vitamin B3 rich foods, dairy products, eggs, enriched breads and cereals, fish, lean meats, legumes, nuts, and poultry. Vitamin D, and vitamin D is really important. It's become a hot topic because vitamin D, we've come to realize that it has a lot of function in our bodies other than just importance of calcium absorption and for osteoporosis, which is when you get breakdown of bone. So vitamin D has been something that's been studied a lot because it also has important functions in our immune system and our skin as well. So it does protect against UV-induced skin wrinkling. But again, at this time, there's not enough evidence to really support the topical use of vitamin D for helping with skin aging. And then with vitamin D rich foods, which is really important not just for the skin, but also for your bone health and your immune system. You can get it from swordfish, salmon, tuna fish, orange juice fortified with vitamin D, milk fortified with it, or yogurt fortified with it. And then vitamin K, it does reduce the redness that can be associated with a lot of UV damaged skin. But again, there's not much scientific evidence showing that any topical use of it is helpful in treating skin aging. But if you want to incorporate that in your diet, because when you incorporate it in your diet, then it definitely can have more use in helping with skin aging. These are the things that you can find that are higher in vitamin K. So kale has become something really popular. soybeans, broccoli, carrot juice, soybean oil, edamame, again, pumpkin, canned pumpkin, like pumpkin pie is great, pomegranate juice, and okra. So one thing that I want you to remember when you're looking out for products out there is that whenever they say it's clinically proven, it only means that the product was given to consumers to try, so it's clinically proven to work. So it's just that consumers found that it worked. But it does not mean that it went under clinical trials and a more rigorous testing of it and received any approval from the US Food and Drug Administration. So a lot of times in the market, they have certain phrases that they try to sell you things with, like, clinically proven, but you just know that that's really just from their own data. Their data, we don't even know, it may be a little bit biased the way that they had conducted it, but they didn't have to go under any kind of more formal clinical trial to show that it's really effective. And then the last topic I want to talk about is just really moisturizing your skin, because that's going to be really important to do as well. So a lot of times I get asked, what kind of moisturizer should I be using, and when should I use it, and what I need to be doing with my bath or my shower. So first of all, with any type of dry skin, even if you don't have dry skin, you really want to keep it hydrated. So we recommend that you don't take any hot showers. Instead, you take lukewarm showers, which is hard for a lot of people. And then when you get out of the shower or your bath, you want to pat your skin dry, and right away, within minutes, you really want to apply a good moisturizer. So you want to apply that because when you apply it on damp skin, it really does trap the water in your skin more, and it is more moisturizing in that way. And then you really want to do that at least daily. If not, if you need to do it more, then you can do it more often. But again, if you put it on dampened skin, it works better. So the moisturizers I recommend are fragrance-free ones, just because a lot of the fragrances can be irritating to your skin. And I find that a lot of the fragrance lotions, it's kind of nicer for the fragrance, but not as great for the moisturization of it, So I do recommend hypoallergenic products, so things that don't have a lot of things in it that have been shown to cause a lot of allergy, but there are people who still become allergic to hypoallergenic products. It's just that they don't contain chemicals that have been shown to cause more allergy. And for the face, it's good to look for ones that are non-comedogenic, which means it doesn't cause acne. So a lot of times you'll see it like on the bottle. Sometimes I do notice they don't say it on the bottle, but if you with the internet, you can look everything up, but they'll say it kind of on that product if it's non-comedogenic. So those are important ones you probably want to use on your face, just so it doesn't kind of make you break out as well. Again, you want to apply the moisturizer immediately after washing, so really within several minutes. And there's creams and ointments which are thicker and more effective than lotions. And lotions sometimes can be a little bit irritating to the skin sometimes as well. So a lot of times when people have really dry skin, I really recommend using a cream type of moisturizer. And then these are some of the ingredients you can look for that have been shown to be more moisturizing when it's contained in the moisturizer. So lactic acid, urea, lanolin, dimethicone, glycerin, mineral oil, petrolatum, and hyaluronic acid. And I'm just going to go through hyaluronic acid and another one called ceramides. It's just kind of more recently, products have been incorporating these two into their product to become more moisturizing. So in terms of hyaluronic acid, it's basically a substance that fills, so this is your skin. So this is the first layer of your skin called the epidermis, and this is the second layer of your skin. And in the second layer of your skin is where your collagen is found. And then you find other things called elastin, which helps with the elasticity of your skin, and fibroblasts, and these are cells that make the collagen. So within this structure, you find hyaluronic acid, and this is just basically a substance that fills between all the spaces of the collagen, but it really provides the structure and support for this whole part of the skin. So the nice thing about hyaluronic acid is it attracts a lot of water. Because it attracts so much water, it actually maintains the moisture. So if you look at the skin, if you take 1 gram of hyaluronic acid from the skin, it can actually bind 6 liters of water. So it's a lot. So a lot of products are incorporating hyaluronic acid into the moisturizer, and this just basically kind of moisturizes it more and plumps it up more. So you may find this in just body moisturizers as well as face moisturizers. And then there's another new thing called ceramides. So From this diagram, again, this is the skin. And ceramides is basically a fatty substance that you find within the dead layer of your skin. So we have the first layer of your skin that I mentioned before. The first layer of your skin was here, the second layer of your skin, and then you have this dead layer of skin on top, which is shown in this slide. And the ceramides basically provide a lot of the structure of this dead layer of skin and provide, really support the barrier. So as you can see here, this is the dead layer of the skin, but as you can see here, that when you have more ceramides there, you have more like a structured dead layer of the skin so that water cannot escape as well or as easily. But when you have any problem with your skin in which your barrier is kind of disrupted, then water can escape more. So with the addition of ceramides into moisturizer products, that does help fill in some of this area. So that would become more like this, and then the water would not be able to escape as much. And that's it. So thank you so much.
Now we'll take some questions from the audience. Someone have questions?
Yes. Yes, so I don't think you have to spend a lot of money to buy really good moisturizers. I'm assuming you're asking about moisturizers. Yes, so the two that I like, and I'll tell you why. I like CeraVe, which is spelled C-E-R-A-V-E. It does contain hyaluronic acid and ceramides, so it's a little bit more moisturizing. And then Cetaphil. And Cetaphil cream I really like, because a lot of moisturizers that are in cream-based, I feel like when you put on your skin, they're a little bit sticky. And I don't like that feeling because my clothes stick to me. So my personal preference for cream would be Cetaphil or CeraVe, but I really like the Cetaphil. Some people, I don't know if you've ever heard about parabens. Some people are concerned about parabens. The concern came from when there's a small study that was conducted in Europe. It was a really small study, about 20 samples of breast cancer tissue. And they tested for different things that they found in these breast tumors. And one of them was they found increased parabens. And they weren't quite sure. And again, this is a very small, what we call sample size. So it was only like 20 samples in there. So their hypothesis was that, well, maybe with the parabens in the deodorants that were used in the armpit, which is in close proximity to the breast, maybe that had possibly increased your risk of getting breast cancer. So this is where it all came from. So there's a lot of, other than also parabens can also be something that people become allergic to as well. So Cetaphil doesn't have parabens, the lotion or the cream. CeraVe does, but now they came out with a baby formulation, which, I mean, you can use it as an adult as well, but is paraben-free. So, yes.
Testing. Hi. Thanks for the presentation. I had a question about the chemical sunscreens.
Sorry, where are you?
I'm ready.
Oh, sorry. Sorry. Like, where is it coming from? Okay. Yes, go ahead.
Voice in the wind.
Yeah.
Yeah, I had a question about the chemical sunscreens that you mentioned. So I read a while back, and I don't know if this is true, that the chemical sunscreens, especially the ones that use things like oxybenzone for that matter, when they interact with UV radiation, they release free radicals into your skin, which is detrimental.
Right.
Have you heard of this? Is it true? And if so, then is there a chemical sunscreen that would work?
Right. You know, I haven't heard of that. The oxybenzone isn't one of the broad spectrum ones, but they do put that on a lot of sunscreens. So, but I haven't heard of that. I mean, it's definitely a very interesting thought and something good to look into, because you're using sunscreen for protection against skin cancer, but also for skin aging, and then it's kind of ironic that it may cause that. So, yes, exactly, yeah. So, no, I haven't heard that, but you know, a lot of the things, especially when I haven't heard of it, it's because it's just kind of a preliminary kind of finding, and a lot of times we do have to look at the ingredient more and do more studies to it before we can really come to a more kind of scientifically based or evidence-based conclusion that it can do it. No, I haven't heard of that. So, but that's a good question. So, okay.
We have one over here.
Okay.
What about driving in the car? Do you recommend for people to wear sunscreen?
Oh, yes. So the main thing is that the windows don't, the UVA and UVB rays come through the windows of the car. So actually it's interesting because when you look at the studies in America, in the US, a lot of the patients, a lot of the people get skin cancer on their left side. Whereas when you go to looking at skin cancer at the countries where they're driving on the other side, the right side, then their skin cancer is more on the right side. So they think it may be related to a lot of the driving that people do. So definitely wear sunscreen even when you're driving. I mean, I recommend really to put it on every day. So every day I wake up, wash my face, put on a moisturizer, then sunscreen. And you know, it doesn't matter if it's gonna be cloudy, because even if it's cloudy, the UV rays are coming through. And you know, a lot of times people will, for example, they'll go skiing and they'll say, well, you know, it wasn't really sunny, but all that UV ray reflects off of the snow and the water too. So it's really important to really wear it every day, just to be safe. And then if you're out for a long time, then again, reapply every 2 hours. So.
And do you have any recommendations for good sunscreen products?
Yeah. So again, this is all just my personal preference. There's a lot of great sunscreens out there. So I prefer physical blockers, which are zinc oxide or titanium dioxide. So if you have sensitive skin that's acne prone, one that's good is Elta MD UV Clear. Elta MD, so ELTA and then MD UV Clear. It's SPF about, I think, 46. It's not waterproof, but it's a physical blocker, and it's a little bit better for acne-prone skin and sensitive skin. And I find that it doesn't really irritate the eyes if it gets into the eyes, but it's not waterproof. So then if you want to think about waterproof ones, there's one that you can get, La Roche-Posay. And I tend to recommend ones that are really ultralight, because I know people aren't going to wear them unless it feels good on their skin. And people don't want to wear something that's really thick and creamy, unless, okay, if you're going to go swimming or something, then I think it's okay to do that. But for daily use, a lot of times people don't want a really thick cream. So La Roche-Posay ultralight sunscreen. If it says mineral, that's titanium dioxide. If it doesn't say mineral, it's the chemical blocker. And that particular one is waterproof. And that women like, it comes tinted. So it's tinted and untinted. So the tinted one is actually really good for any skin types, even if you're very fair. I have a lot of patients who are very fair skinned and like to wear it because it's almost like a very light foundation. So that one's kind of nice. And there's another one that you can get that's also waterproof, and it's a very, very, very soft feeling one. It's like almost feels like powder after you put it on, but it's called Tizo, T-I-Z-O. And it comes tinted as well. So if it's tinted, it's Tizo 3. If it's untinted, I think it's Tizo 2. But that's waterproof as well. And it's like when you put it on, it feels like powder. Those are the ones that if you're looking for something kind of more to use every day on your face, where I feel like you want something that feels okay. Other than that, like when I go out, if I'm going to be on this, like go swimming or something else, I mean, it doesn't matter. I don't care about lathering on even the less expensive stuff, because I'm going to be I'm not going to work or something like that. So a lot of the ones, I mean, I use Neutrogena, there's Aveeno, CeraVe, a lot of them have great sunscreens. Sometimes they add moisturizer in them as well, so those are really good ones too. The ones that I commented on, they're not super expensive. They're probably about $25, $30 a bottle. So the ones that I had, the 3 that I mentioned, I usually recommend just using that to the face because it feels a little bit better and nicer. And then for the body, you can use, because you have to cover a larger area, so you probably don't want to go as expensive. So, Yeah.
For every day, if you have a moisturizer that's SPF 20 or 30 and you're in an office all day, is it something that you should reapply if you have limited sun exposure?
Right. So if you're in the office all day, so it depends, I think, if you have a window or not. So if you're lucky, you get a window. So if you do have a window, it's not a bad idea to reapply several hours later, especially if you are having a lot of the UV light coming through, if you don't have a curtain. If you're just in the office all day, you probably don't really need to reapply, but let's say, for example, after work you're going to go somewhere, then it'd be good to reapply again. Yeah.
Any other questions? Yeah. Okay. I'll get to that side of the room, I promise.
Do spray-on sunscreens have the same efficacy as the lotion formulations?
Right. I don't recommend spray sunscreens for several reasons. I know a lot of people like it because they feel like they can use it more. One, There's a concern that the spray sunscreens with the chemicals, if you inhale it, it may be toxic to your lungs. So that's one thing. So that's not good. And number two, I actually had someone come into my office for a rash. And it was this young gentleman. He was like, I have this rash on the back behind my shoulder. I'm not quite sure what's caused it. And I look at it, I'm like, did you get a sunburn? And he said, well, I sprayed on that sunscreen everywhere. I'm like, well, it looks like you missed that big spot. So it's very easy to miss spots when you use the spray on. If you are going to use it, what I recommend is that you spray it into your hand and then put it on your skin. I find a lot of parents like to use the spray on for their kids as well. I really don't recommend it just because, again, I don't want anything to be toxic to the lungs. But if you're going to do it, then just put on the hand, put it on, do another coat, put it on, and do it that way. But so I don't recommend the spray ones. Yeah.
Have there been any studies that show a correlation between like using sunscreen every day and vitamin D deficiencies?
Yes,
Isn't
of course.
that
Yeah.
like a trade-off?
Yes. So using more sunscreen does. There has been some correlation showing that their people have more vitamin D deficiency. But as dermatologists, we recommend that you you also get vitamin D from your diet as well, because we have some patients who have a lot of skin cancer already, and so I really don't want to be recommending them going out in the sun for 20 minutes a day because they really may be doing for 60 minutes a day, So, we do recommend supplementing with the diet. So one of the charts that I had up there, and also you can take vitamin D supplements as well. So, but a lot of the people actually, there's been a lot of studies to show whether or not we really should be upping the what we want the vitamin D levels to be, because of a lot of more recent research showing that before we used to always think, oh, well, it's important for osteoporosis. So a lot of the numbers they came up with for your blood level of vitamin D came from studies showing, how low can you go before you get osteoporosis, or how much, But now there's a lot of studies showing that vitamin D is important for other things too, including your immune system. There's some studies showing that whether or not it could be a little bit protective for certain cancers, internal cancers, and a lot of other functions in our body as well. So there's been kind of some talk in the medical community about whether or not we really should be increasing that level that people should be reaching as well. So, but supplement with the diet and take vitamin D supplements is good too. So.
Do you recommend fabrics, like clothing that are sunproof or sunscreen-proof?
Yes, thank you. That's a very good point that I forgot to mention. So there's UPF protected clothing now, and they'll usually say UPF 50 plus, and you can find them in a lot of sports stores. Online, there's a lot of websites that actually sell a little bit more updated or fashionable UV protected clothing, and also UV protected hats. So basically, the UPF of the clothing comes from the type of fabric they use and how tightly woven it is. So I really do recommend a lot of people actually going out and getting, and they have kind of, fashionable, not very, ones that are casual, fashionable that people would wear. You can buy online, or even a lot of the sports stores. Costco sells the hats too, and you can kind of find it everywhere now. So, but that's really a really good point.
On a lot of sunscreens, they don't mention if it's oil-free or not. Are they considered comedogenic?
Right. So a lot of the ones that are non-comedogenic are oil-free. So I know it's hard because I do sometimes, even when I look at products on the bottle, it doesn't say. So what I do is I'll also look it up on the internet. If you're interested in some sort of moisturizer that your friend really likes and you want to see if it's non-comedogenic, a lot of times if you look at that product online, then if you start looking at all the detailed information, it may start, say non-comedogenic on it. But you really want to just look for if it says non-comedogenic. Yeah, I think, I would have to double check on that, but the sunscreens, I think if you look online, they may be non-comedogenic, but I can't be completely, I'm not quite sure about that for the sunscreen. So usually for the ones when I do have patients who have very acne-prone skin, I really like the Elta MD UV Clear. I find that doesn't break people out as much as a daily use. And then when you're going to be sweating or going to be in proximity of water, like swimming or something like that, then use a waterproof one. So you're not really using that every day.
In terms of application with the sunscreen, with makeup, so should we apply that before or after makeup? And can you reapply it when you have makeup on?
Right, so I know it's hard. That's actually a very common question I get from a lot of women. So the order that I tell people to do it in, it kind of makes sense when you think about it. So you want to wash your face, pat it dry, put on your moisturizer, then put on your sunscreen because you want the moisturizer to really set in your skin more because you want it to moisturize your skin. And then the sunscreen is more like you want to block the UV rays, you know, so then you can put on sunscreen and then makeup. So you put on makeup on top. But then, yes, people always ask me, well, how do I put sunscreen back on top of makeup? So either you can either put the sunscreen on and have have powder or something to put it back on, or one that women like a lot is a tinted sunscreens because when you put it back on, it's kind of tinted like a foundation, so they don't worry about it kind of ruining their makeup as much. So that's why I think a lot of women like the tinted ones now too. Yeah. Yes.
Sorry.
I
have the mic.
Uh-huh.
What is a good vitamin C product?
Yes, I know it's really hard. I don't have one that's a really good vitamin C product. There's so many. It's hard because there's so many products out there, and I do have people coming into my office all the time and saying, "Can you look at this product I bought? Can you just look at these 100 ingredients that it has and tell me if it's good?" And the thing about cosmeceuticals that it's really hard to say because, again, they say clinically proven. They don't have to actually go through any more clinical trials for it. So it's really just based on their marketing. So the vitamin C product that I would, if it has that one ingredient that I put up on there with a star, that one would be the most stable one and the most penetrated into the skin. But I don't have a particular product or anything like that. I don't know how to make your own vitamin C serum, but yeah, I think the problem with that is, again, the stability of the vitamin C. If you were to take it out of an orange or something, is that what you're talking about? Or like a powder? I'm not. So the thing is, technically vitamin C, like I mentioned before, if it's exposed to oxygen or light or heat, then it gets broken down more. So if you have it in a powder form and then you mix it yourself, technically it's already exposed to oxygen. So the products that are better in terms of their vitamin C being more stable, they really have to produce it in a more tight environment where they're trying to really limit its exposure to oxygen. So theoretically, if you were to make it yourself out of powder, it probably wouldn't be that effective. Okay, yes.
Is this the last question?
Oh, shoot. It's a lot of pressure. I was actually going to ask a couple questions, but okay. So firstly, the cancers that you mentioned, the squamous cell carcinoma, basal cell carcinoma, that we should be looking out for, are these commonly in areas that are exposed to the sun, or should I be looking in areas that are, usually covered?
Right. Also. So for basal cell cancer and squamous cell cancer, they're usually in the areas exposed to the sun.
Okay.
But there is a type of basal cell, it's a really cute name called pincus, that you actually see in non-exposed areas like the butt. And these are people who don't bathe nude, so you really should be looking everywhere, but for basal cell and squamous cell cancer, they're more on areas that are exposed to the sun. So a lot of the face, the scalp, the ears, neck, hands, arms, feet, legs. In terms of melanoma, you can really get it anywhere. In men, you see it more on the back. And women, you see more on the legs, but you can really get it anywhere. So with melanoma, it's really important, again, it's like the most common type of cancer in young adults. It's really, really important to, if you have a lot of moles, to get it checked, because I've had a number of instances where I would have a young adult come into my clinic, 21, 22 years old, comes in for a rash, and I say, well, anytime I see a new patient, I like to do a full skin exam because I like to see if I'm missing anything. And they will be persistent. Look, I'm fine. Just look at this rash. No, let me look at the rest of your body. I'm fine. And I will catch a melanoma. And I mean, it doesn't happen often, but it's really scary when it does because they were completely not concerned, or it's in an area where they can't even see. So melanoma, you really have to look anywhere on your body. Okay. So in people of more what we call pigmented skin or ethnic skin, which is like Asians, Hispanics, Latinos, African Americans, from melanoma, they tend to get it on the palms and the soles. So areas that's actually not sun exposed. And when this population of people do get melanoma, they tend to be more aggressive and more deadly. So we always have to make sure, I always make sure I check the palms and soles, toenails, fingernails of everybody, because in between the toes, because you want to make sure you're not missing anything. So, but just because you get a mole on the palm or your sole does not mean it's a melanoma, but it, you can get it there. Yeah.
And then last quick question. This is kind of personal, but so
I heard there's no personal questions, but
not actually personal. So as a male who has scruff, I don't like putting sunscreen like on area with facial hair, and I know a lot of my friends feel the same way. So I'm wondering, I know you mentioned if a male is balding, for example,
Right.
you should get at that area, but what do you recommend? And because when you put even like the creams that
Right.
Look fine, when you
Right.
put it in facial hair,
Yeah, it
it
looks
kind of
funny.
gets really
Yeah, so actually,
good looking.
this is where the spray may come into play. You can use a spray, the spray sunscreen, put it in your hand and rub it through. The spray is going to be more of a liquid, like water, and so you can kind of rub it through there. Your facial hair, if you do have a lot of facial hair and you keep it there, then that facial hair will help protect some of the UV rays. The more dense hair you have, meaning like, for example, on your scalp, in the areas that we start losing kind of hair, or for, even for women, the part lines where there's not as much hair covering it, those are the areas that are going to be more risk of getting skin cancer. So if you're having a full beard, then it's better, but I have caught and found skin cancer like basal cell and squamous cell in the beard or in the mustache. So yeah, you can just go ahead and take that maybe liquid spray and rub it in there. It'll be a little bit better. Yeah, thanks.
Thank you so much, Jenny, and thank you for such a wonderful presentation. What did you guys think?
Thank you.
Thank you, everyone, for coming tonight, and I hope you enjoyed the event, and I hope you learned something new, and we'll make sure you protect your skin. And we hope you come back to our upcoming events. On May 6th, Young Alumni Professionals is in a volunteer group here on campus in Alumni Affairs. They're hosting a mixer at the W right across the street. And on May 16th, it's Alumni Day, so we hope you come back to campus. Attend Alumni Day during the day, and then at night, we'll have Spring Sing for you. And tickets are available right now, and our George and Ira Gershwin Award this year will be given to Anthony Kiedis. He's the lead singer of Red Hot Chili Peppers. And I think we're all the age that we know Red Hot Chili Peppers, right? Perfect. And so join us on our Young Alumni Facebook page where we have a lot of information, upcoming events, anything important. We'll post photos from tonight and any important information that young alumni need to know about, whether it pertains to UCLA, resources, programming. And for those of you who've missed our past events, we have our videos online, the UCLA Alumni YouTube channel. So check that out if you've missed our past events. Okay, time for those fun giveaways. Take out your tickets. So tonight's prizes, each prize is a little reminder. It serves as a little reminder of what you've learned tonight and to continue protecting your skin. Do you want to do the honors of selecting the ticket? So the first prize is a UCLA baseball cap.
Okay, so 423-5598. Did you get it? No. 423-5598.
So when you go hiking, make sure you wear a hat. And the next item is a water bottle. Stay hydrated.
423-5602.
Yep. And the last item, or not the last item, the next item we have is a UCLA umbrella. So stay out of the sun, well, if you're out and about, you can still stay protected.
423-5647.
And our grand prizes, and it's been mentioned, the brand has been mentioned a few times tonight, La Roche-Posay. So there's over 15 items in this basket, and I think it's worth over $300. So it's a pretty fun prize.
I'll mix it up even more here. Okay. 423-5620.
So like I mentioned earlier, no one goes home empty-handed tonight. A lot of our team members are sporting these clear plastic bracelets here. Right now they're clear, but when they're exposed to UV rays, they will turn blue, kind of like this color blue. So UCLA blue. And they don't do anything to really protect you, but they do serve as a reminder that you should have worn sunscreen this morning. And you should reapply in 2 hours. So they're at the check-in table, so you are free to network, and you are free to ask Jenny any questions you have left, any not so personal questions, please. And we have plenty of bracelets for you. Yeah. Thank you.